Thanks for tuning into the Zealous Podcast. I'm your host, Rocky Snyder, and this week I've got Christian Huckfeldt with me, Doctor of Physical Therapy. He's with the minor league Houston Astros organization out in Florida. We're going to get underway with him in just a minute, but before that, check out RockySnyder.com. We've got continuing education workshops online as well as in person, and they're great CEUs for athletic trainers, chiropractors, physical therapists, strength coaches, and personal trainers. So if you're needing some CEUs this year, check us out and what we have to offer. Also, speaking of education, SatantaCollege.com, well, that's a place to go if you're a master's of science in performance coaching. But they've also got programs for sports injuries and return to performance management, not to mention applied sports biomechanics and movement science. And finally, applied sport and exercise psychology. That's SatantaCollege.com. If you enter RS10, you get 10% off tuition. Follow us on Instagram at Rocky_Snyder. And remember, just click that subscribe button. Do us all a favor and join the crowd and enjoy the show. Well, thanks for coming on, Christian. I'm looking forward to this conversation. I always love getting into the minors and talking about what's going on there, because there's so much more, I think, going on with minor league players, A's, Triple A's, and so on, that you've got more room for improvement, and you probably got a lot more coming across your plate. So first of all, welcome to the Zealous Podcast.
Yeah, thanks so much for having me. Looking forward to chatting.
Now, you're with the Houston Astros organization, but you're based out of Florida because you're at the complex there. And you've been doing this for about a year now, coming up on a year. How's it been so far for you?
Oh, it's been great. It's been a really awesome opportunity. Obviously, it's only been a year, but loving all the experiences that I'm having, trying to be a sponge and soak up as much as I can and just continue to contribute.
Okay, give me like a highlight reel. What are two top things that have happened to you in the last year that you're just like, I love doing this?
I think anytime you take a player from start to finish in a rehab, so whether they're a post-op or a conservative treatment, and you watch them typically start a rehab assignment, whether it's here at the complex or at an affiliate, no matter what level that player is, what age, what position, I think it's always awesome to kind of see them through the entirety of it. So I think anytime we get a player back into games and watching them go out there and compete is always a top one. And if I had to say, probably a second one would be Astros and ALCS last year. Obviously, it was my first season, so it was a lot of fun. Unfortunately, we didn't make it to the World Series, which would have been a really cool experience. But obviously, getting to root for the big league team and ideally helping some of these minor league guys work up and get into a big league level. So,
And you yourself, what kind of sports did you play growing up?
I played mostly baseball. I played a little bit of basketball and soccer, but kind of ended that maybe midway through high school just to focus a little bit on baseball.
And did you go up into the college ranks of baseball, or how far did you go?
Yeah, I did. I played a little bit of Division III ball. I wasn't incredibly talented, but I went to a small Division III school where I knew I could play baseball and then also study exercise science leading into PT school. So I was fortunate to kind of have the best of both worlds there.
Okay, not that I have a crystal ball or anything. I'm just going by the odds that most people that get into your field have had some experience, including athletic trainers, not just physical therapists, but growing up, they got injured and then they worked with somebody that was very monumental and influential in their development, and it opened their eyes at a possibility of following their footsteps. Does that ring true for you too?
Yeah, it's funny. I feel like three-quarters of our PT school class all kind of had a similar story. I did too. I was maybe my freshman or sophomore year of high school. I rolled an ankle pretty bad, so I was in a cast for a while and eventually moving into a brace. And I worked with a pretty awesome physical therapist who kind of led me all the way from initial injury all the way back. And I made it back just in time for baseball season. So it was really awesome. It was a really cool experience. And I kind of knew from the mid high school days that I wasn't going to go on to play professional baseball. I loved the game. I was decent enough to have an opportunity to play in college, but I knew I wasn't probably going to go on past that. So sort of after that experience, it was like, oh man, this physical therapy, this athletic training stuff's pretty cool.
And where did you go to school for
I
your
went to
DPT?
Yeah, so I went to the University of Scranton. It's a small school about 2 hours north of where I grew up, just outside of Philadelphia.
A block away from Dunder Mifflin?
Yeah, basically. Yeah.
Excellent. And so while you were there, you realized that you want to follow into more sports physical therapy. What steps did you take to make that a reality?
Yeah, so it's funny. I went into PT school pretty darn confident I wanted to be in sports physical therapy. And I was fortunate to have a couple mentors early on in the program who really kind of encouraged me to keep my options open and keep my mind open. So I actually went through a few phases early in PT school where I thought maybe neuro was where I wanted to be, or maybe the acute care setting. And fortunately, was able to have a couple clinical rotations in both of those fields and pretty quickly learned it wasn't for me. And so I kind of trickled back into sports, which is kind of always had my heart. If you know me, I kind of am always watching sports, always around different sports, love being around the games. And so maybe midway through PT school, I kind of settled back on sports. Was really fortunate to have a couple of roommates too who really love sports, and we all kind of sat together and went and did the CSCS together. So that was sort of one way that we were getting into sports. Another thing that was really helpful is because the University of Scranton isn't a huge school. I was fortunate in that when I stopped playing baseball there, our head coach just asked if I would write the S&C for the baseball team for 3 years. So that was just kind of a quick and dirty way to get in the weight room and get my hands on programming. That was honestly probably one of the reasons why I went back and got my CSCS in the first place. So I think those two experiences helped to guide that I definitely wanted to be in sports PT. And then lastly, really lucky, the University of Scranton has a clinical rotation where one student every year goes out to Scottsdale, Arizona to spend their last clinical rotation with the San Francisco Giants organization. So that was my last clinical rotation. I knew I loved baseball. I was pretty confident I wanted to be in sports. And I was out there, I was submersed in the baseball PT for 10 weeks out there. And it was a really awesome experience. And that really kind of solidified that, yes, this is exactly kind of what I want to do with the rest of my life.
It's interesting. Not the Phillies or the Pirates, but the Giants. What's the affiliation with Scranton, Pennsylvania, and the San Francisco Giants?
I believe, don't quote me on this, but I think there was a student who went to the University of Scranton who went on to work with the Giants as a physical therapist. So I think that's how they kind of helped to get the affiliation set up.
All right. And speaking of affiliation, when you were growing up, which team were you rooting for? The Reds or maybe the Indians
I
or
definitely
Guardians?
Definitely, grew up a Phillies fan. Yeah, I grew up just outside of Philly, so I was a diehard Phillies fan, growing up. Actually, one of the claim to fame that I had when I was younger is I actually went to the 2008 World Series game where the Phillies won it, which was a really cool experience. I was only 12 or 13 years old, so as a middle schooler, that was a pretty neat experience for sure.
That's amazing. Yeah. Well, I have a feeling that probably won't be the last time that you have an experience like that. Okay. So let's get into the nitty gritty of physical therapy and professional baseball. Um, Top three common things that you're treating and addressing.
Yeah, I think it's probably pretty universal. I think a lot of it is going to be the elbow. I think you're going to see a ton of elbow, whether it's post-op or whether it's conservative. I think you're going to see a ton of shoulder as well, whether it's a cuff versus like a labral injury, or whether it's even the muscular attachments like a lat injury. I think you see a lot of those, and actually the number one injury pretty typically every year is hamstring strains. So we do see a decent amount of hamstring strains and just lower body soft tissue injuries in general.
Okay. Tommy John surgery has been around for 30 years now. It
Yeah.
doesn't seem to have changed all that much. Maybe I'm wrong, but how much has the rehab setting changed in those 30 years when bringing players from rehab to return to performance in regards to the Tommy John surgery? Granted, you've only been doing it for a little while now, but have you been seeing already changes in your protocol?
Yeah, absolutely. I think kind of at least from a post-operative standpoint, I think the initial thought with a lot of these TJs and the full UCL reconstructions is we might be able to get them back in that 10 to 12 month span. And I think a lot of PTs early on started to kind of push that. Let's get them back earlier. Let's get them back faster. And I think it's just like the pendulum, right? You go one end and you realize, oh, we probably can't do this 10 to 12 months. We're seeing some re-injuries and we're seeing some adverse events. So maybe we should push it to more the 18 months. And then you see a lot of people who are coming back after 18 months, but maybe they don't have the same ability to compete because their peers and their other players have passed them by. And so I think the timeline itself has kind of come back to the middle. I think you hear a lot of different numbers and it's very case dependent, dependence on the player, the physician, the position, how well they do, any setbacks. But I think anywhere between 12 and 16 months is a pretty realistic goal for getting back after kind of return to throw plays with Tommy John surgeries. I would also say one of the other things that has kind of changed and is still always changing is the return to throw process in general. I think a lot of people tended to use like a very strict distance-based program, where you throw to 60 feet and then you throw to 75 feet and then throw to 90 feet, because that was just some of the early protocols that got put out. And I think as more objective technology and more objective data comes out, people are starting to trend away from distance based a little bit, just because, I mean, if you think about it logically, I could throw you the ball 40 miles an hour at 60 feet, or I could throw it 70 miles an hour at 60 feet. And the difference in intensity is obviously so much different compared to 40 versus 70 miles an hour. So I think people are starting to use objective technology in order to kind of track progress a little bit more. It's a field that obviously as more technology and more data comes out, it's going to always evolve. I'm sure what we're doing now will differ than what we're doing in 5 and 10 years from now. But I think those are two of the main kind of differences that we've seen in the return to play following TJs.
And then, so historically, there's been more like a isolated approach to rehabbing, where the focus is going to be primarily on the elbow, or if it's the shoulder, it's going to be primarily on the shoulder. If it's the hamstring strain, it's probably going to be primarily on the hamstring. But we're integrated, and we've known now that we've got these fascial slings, and they are all participating in acceleration, deceleration, and the proper kinematic sequence of movement is something we're trying to attain. How much do you look at that with your athletes, or is that later down the road after you've handed the baton over to the rehab strength specialist?
Yeah, I would say it kind of depends on the player, the surgery versus a conservative treatment, how long they're going to be with us in rehab, the mechanism of injury. I think maybe if somebody, for example, gets hit on the hand with a 95-mile-an-hour fastball and they break their hand, probably some of the other joints maybe are not as important and relevant because it is a contact injury. You probably couldn't have done a whole lot to prevent it, versus somebody who maybe is an older, aging veteran and they've had some chronic issues in different joints or different tissues. That may be something that we pick up in the subjective and we dive a little bit deeper to, kind of in that setting. So I would say it kind of depends on the position, the player, how long they're going to be in rehab, and a couple other factors.
Take me through the subjective. What do you do in that situation?
Yeah, I mean, I think truthfully, it sounds really cliche, but I think the subjective is probably arguably more important, if not more important than the objective, because I think uh, we were taught this all the time in PT school that a good subjective really should kind of lead you right to the objective. So, I mean, I think there's a ton of different ways you go with it, but what is the mechanism of injury? How did it happen? When did it happen? Was this something that kind of gradually came on, or was this more of an acute mechanism of injury? What does their training history or training load look like? Was this something that was maybe a really high chronic load injury that they were just doing a lot for a long time? Was this something that they maybe had a lower chronic workload and they spiked an acute workload? So maybe it's a really fast spike in something. That's what brought it on. What other tissues have been injured? Anything that has been nearby? What is their interest in doing rehab? What do they like to do? What have they done in the past? What works best for them? What doesn't work best for them? If we have a 16 or 17-year-old kid, they may not know what works best for them yet because they're just professional. Versus if we have a 36-year-old veteran who's been in the big leagues for 8 years, that's a whole other story because maybe they've been really healthy for a long time and they've known their body for 37 years. I've known it for 8 minutes. So that's a whole nother kind of avenue we could go down as well. Um, Also the severity, like what is the, I know it's a little cliche, but what is the pain rating now versus where was it a week or two ago or a day or two ago? If we irritate it, how long is it going to stay irritated? So if it's somebody who they have a cranky shoulder and after they stop exercising, it calms down in an hour, I know I can push a little bit closer onto some rehab stuff versus if this is a let's say an Achilles tendon that has kind of been off and on for a while. And when it flares up for 2 to 3 months at a time. Well, I need to be a lot more careful on my initial exercise because if I spike that acute workload right away, we're going to have a lot longer issues. So I think all of those things kind of play a role and it's person dependent. It depends on, like I said, the age of the player, why they're with us, what the mechanism of injury is, and just a number of other factors as well.
Yeah, sounds solid. And so When it comes to hands-on work, what are your go-to techniques? What are right now, based on what you've picked up, are there certain approaches that you prefer? Of course, it's going to be case dependent, and I understand that. But like in your toolbox, what do you have?
In terms of like manual therapy and stuff like that.
Yeah, exactly.
Yeah, I mean, pro sports is obviously difficult. A lot of athletes come in with a preconceived notion of like what the training room should look like or what physical therapy should look like, and unfortunately, a lot of the times there's a lot of emphasis on passive modalities, and a lot of massage and mobilization and soft tissue work and Graston and things like that. And this is not to say that those things don't have a place in pro sports. Of course, they do at the right person at the right time at the right place. But I think ultimately probably an active advice and an active part in rehab probably is going to get them better and potentially help keep them that way. So I would say truthfully, like the crux of my practice is like advice, education, and exercise. Like the sheer amount of times that we can just talk about workload and we can talk about how they are structuring their days and their weeks, what they're doing in terms of sleep, stress, nutrition, what they're doing in terms of exercise, how they structure their training programs. Like I think all of that is going to be like the crux of what rehab probably can be and should be. And then I think there is a role for these passive treatments, whether it's soft tissue mobilization or whether it's a manipulation at the right place at the right time for the right player, also with the proper education, right? So like I'm not breaking up scar tissue. I'm not realigning muscles or realigning joints. Like we know that that's not what's happening. It's probably just changing the stimulus for the nervous system, which may make you feel a little bit better. And if that is what a player needs, if they're also hitting all of the other buckets that I mentioned, that's fine. I don't have a problem doing it. But if they are doing that and then just blowing past their chronic workload, or they are doing that and sleeping 3 hours a night, eating two Domino's pizzas, like that's a waste of my time. I'll do it if they need it, but it's something that you obviously need to make sure that they're hitting all the other buckets as well.
That was an awesome answer. Not the one I was expecting, which makes it even better. Okay, so forget the passive. Let's go active. So BFR, do you do a lot of blood flow restriction training?
Yeah, yeah, for sure. Once again, depends at the time and the person and the place,
Sure.
but in the acute post-op period, when we are not able to load a specific joint or a specific tissue with a substantial amount of load because that tissue is still healing, I think BFR is a tremendous option in order to get a stimulus that we are just not able to get because we can't load the tissue or the joint appropriately. So I think that is awesome in the acute post-op phase, as long as they are indicated for it, they don't have any contraindications, and we are making sure that we're doing it appropriately. One thing that we've also kind of played around with is a little bit of the BFR recovery. So the 25 minutes IPC pressure with 5 minutes on, 5 minutes off in order to get a little bit of a systemic benefit as well. So yeah, I will use modalities and things like that when it comes time, especially in the acute post-op phase.
How does that work with the recovery of the BFR?
Yeah, so typically
25 minutes.
Yeah, so we'll do it 25 minutes. And typically the occlusion pressure is pretty darn high, and it goes 5 minutes on, 5 minutes off. They're not doing any exercise. And the goal is really to get a kind of systemic benefit and a systemic recovery. So some of our guys like doing it post game. Sometimes we'll put it on and we'll do like a BFR bike ride. It's just like a kind of a lower body active recovery the day after an outing or the day after a high stimulus day.
And what do you see with that?
Yeah, it's a good question. To be honest with you, I haven't seen any randomized controlled studies to determine like legitimately how effective it is. Anecdotally, a lot of our guys tend to like to use it and they feel better from a systemic recovery standpoint. But I certainly don't have any legitimate research to back that up right now. I don't know if there's anything being done, but I know it's been out for a little bit. I know a good amount of organizations and good amount of therapists that use it, but I haven't seen any randomized control trials to compare it to somebody who just went home and got a good night's sleep anyway. So, yeah.
Got it. Okay, KT tape. I'm sure you use it to some degree. What do you think of it? Does it have
Uh,
its place in, or is it just something that you have on the side of your belt with scissors, or what?
yeah, to be honest with you, I really don't use KT tape a whole lot. If I have somebody coming in and they have used it in the past and they really like using it, it's something that theoretically I would look into potentially slapping a piece of KT tape on if it helps them feel better or more mentally secure to go out there and do an activity. But I probably wouldn't say, hey, to a player, this is probably what we need to do to get you over the hump. If that makes sense.
Yeah, totally does. So, are there specific tools, pieces of equipment that are in your room that, hey, well, out in California, if there's an earthquake, that's usually the same. What are the things you're going to grab first? But if the hurricane is coming down upon you in Florida, what are three things that you're going to grab first before you exit the building?
Oh man, I am looking at one right here. My my handheld dynamometer is probably what I use. I use it every day. I would use it more if I had the time to sometimes. And so I think a huge part of rehab is providing objective data to help guide decision making and return to play frameworks. And so we have a handheld dynamometer here from Dynamo, which is a product from Vald, where we can test shoulder, elbow, knee, hip, all kind of objective tests to look at force output and force strength. So I use that
Wait,
with
how? Okay, hold on. You're using it's a handheld, a grip dynamometer.
no, so it's not a grip. It's a handheld dynamometer, meaning I can hold it in my hand as a clinician, and there are
Okay,
a ton of different parts and pieces that you can put on. We have a leg strap that somebody can do like an isometric knee extension test. We have
got
parts
it.
that I could do like an isometric scaption test. There are a ton of different parts and pieces that we can kind of clip in and clip on in order to test different body parts, different segments.
Do you use it also as an exercise device, as a training tool rather than just an assessment tool?
Yeah, 100%. I mean, I think,
Okay.
like, for example, maybe in an acute post-op, I think a lot of the times for a shoulder, you'll see in a protocol submax ER and IR isometrics. And that's wonderful. And the patient's going to push into a pillow on the wall, but they're saying, how hard do I push? And you look at them and you say, I don't know, maybe a little harder, or hey, maybe not as hard. Like I think there's probably a time and a place for that, but I think that's a little difficult in order to be consistent over time. And so we can use this and we can set it up. And ideally, in this case, we have a pre-injury baseline. So if I know somebody is pre-injury baseline, their shoulder ER score, for example, is 200 newtons, maybe I want to take 30% of that because I know with research or with a protocol that that's probably a fine MVIC and they're not going to re-injure themselves. 30% of 200 is whatever that number is. And I tell them, hey, build up to this number and hold it there for a certain amount of time. And I don't use it all the time, I would say, but it certainly can be a little bit more objective and can help us to get the exact stimulus we're looking for.
Very cool. Okay, and when it comes to holding, just do you have a golden number? This is 10 seconds, a 20-second hold, 30-second. Do you have a variable kind of program where it's undulating the duration of each isometric hold?
Yeah, I think it depends on what the purpose and why you're doing it. We've seen with some tendinopathy studies, isometric holds up to 70% of MVIC for 45 seconds. 2 to 3 rounds of it have a pretty good pain reduction um,
Oh,
part of it. So sometimes for a tendinopathy, we might do a little bit longer ISO hold. If it is like a cranky shoulder or a cranky knee, and I am just easing into that joint moving in a certain way, I might pull back on the intensity, might pull back on the duration. It just kind of depends on, I guess, the purpose of doing it.
okay. So dynamometer that goes in your bag as you're running out the door. Anything else?
Yeah, I think it's probably a little corny, but just like a plain old goniometer would be awesome, especially working with pitchers. I'm trying to measure their shoulders, not daily because that's just not feasible, but at least once a week, especially as we're ramping up throwing volume and throwing intensity. I think one of the easiest ways you can potentially help identify a cranky shoulder or a shoulder that may become cranky is by just tracking their range of motion over time. I think kind of too much we have guys who just go out and throw and they lose a little bit of shoulder flexion every outing and every outing and every outing. And next thing you know, 6 to 8 weeks later, they've lost 10 to 15 degrees of shoulder flexion, and now it becomes an issue. And we run the risk of maybe a lat injury or another injury like that. So if I can pick up on some of these subtle differences by testing these range of motion every week, it can potentially help. Obviously, it's important to note that there's measurement error every time I do it. So I'm not saying that, hey, man, a 2 degree difference week to week is 100% dangerous because there's measurement error and there's a ton of other things that go into these. But if we can potentially use it to help identify patterns over time, it may allow us to just educate and talk about either workload or talk about how we're programming for our players. So I would say that's probably my third. Um, and I guess it depends on how strong I'm feeling and how much I can carry. But the third thing I would probably use would be our force plates. We're fortunate enough to have vaulted force plates that we use almost every day. Not for every player every day, but we're using them as frequently as we can to get different metrics and variables to monitor fatigue and monitor force expression, force absorption, ton of different variables. And so I think they're heavy, so I'm not sure I could carry all three of these things at once. If I have enough people coming with me, that's probably the third thing I'm going to bring.
All right. Well, first off my head, you're just like an old sea captain with a sextant, rather than having a smartphone app as a goniometer. You're going with the old uh, diehard plastic ones or whatever. But then the force plates. How do you deal with upper body extremities uh, force production with the force plates?
Yeah,
Are you
so
putting them in? Yeah, go ahead.
yeah, I think there are a ton of different tests that we can use and that are shown to be helpful in the literature. The modified Ash test is one thing that Ben Ashworth has done a really good job at just raising the bar for and talking about. So that's basically a prone I, T, and Y test. The initial research was done, I believe, on rugby players and looking at shoulder instability. But there has been some interesting studies that have come out recently with baseball players and looking at differences in the modified Ash test. Depending on the injury as well, you can do different push-up tests on there, and I think you got to be creative to a certain extent. You got to understand what you're looking for, what you're dealing with, and if there is a test that is valid and reliable out there that helps to test some of the constraints you're looking for, that's great. And there are some other times that there are not specific valid and reliable tests that are out there, but we will play around and see if we can put somebody on a force plate and detect any asymmetry. Obviously, understanding that if there isn't any studies out there, it may not be as valid and reliable as we want it to be, but it may be better and it may be able to provide us an objective piece of information that otherwise my eyes couldn't show me.
Well, I was going to ask that if validity or reliability is your chief concern, but it doesn't sound like it is. It's efficacy. What's going to be the most effective thing? Because research actually is behind, but
Sure.
with what you're doing, and it has time to catch up. But usually, it's a couple of years, if not more, behind. So back to your ISO holds and your dynamometer. That, for instance, like the shoulder, are you placing the shoulder in IR, ER? Are you also flexion, extension, abduction, adduction? I mean, how many different positions are you going to test that one articulation?
It once again kind of depends on what the injury is. So if it is for example, if it is a shoulder injury and a pitcher has discomfort in the layback position, I'm darn well going to be testing ER and IR force production in the layback position. If it is for example, a supraspinatus injury, I'm probably going to test scaption in certain different positions. If it is a dislocation type of injury, depending on the part of what part of the capsule is dislocated or what part of the joint is irritated or what position they were in when they dislocated, I'm probably going to try to mimic or recreate that position and see if I can test force in that position, if that makes sense. And then that's something that we continue to kind of monitor over time and ensure it's trending in the right direction.
Got it. Okay, you got a whole team there, and I don't mean the players, I mean the support crew, the medical and training staff. Out of all those other professionals there, is there one that you feel like is not your sidekick, but somebody that you work almost hand in hand with? And I don't mean another physical therapist, but whether it's the ATC, whether it's the strength coach, whether it's the sports scientist, who do you find like, I'm going to this person when I'm looking for answers?
Yeah, it depends on the answer that you're looking
Don't
for.
be depends. I know
Um,
it's all my questions have depends. That's
it
funny. That's like I'm an old man with a bladder issue. That's it. It
um,
depends.
It
Anyway,
depends. It depends always bothers me as an answer, but I will say it depends on what. So it depends on the answer that I'm looking for. I mean, we're really, really fortunate in the setting that I'm in, that the office that I'm currently sitting in, I sit with another PT, another strength coach, our rehab pitching coach. We have a rehab position player coach. We have a mental health professional. We have sports scientists. We have nutrition. We have all of these different disciplines. So we are constantly tagging in each other for whenever these things pop up. we could have a rehab where somebody's doing great physically, but we know, hey, there might have been something going on at home. We're going to tag in our mental health professional immediately.
Sure.
We notice something in a dietary change. We're immediately tagging in our dietitian. So we have so many of us that are kind of all there, and we all work really intimately together. And that's the really fortunate part about the position that I'm in, is that I don't have to wear 8 different hats. Like in the outpatient setting as a physical therapist, frequently you are the physical therapist and you can potentially program some S&C, and you are giving some maybe general advice about nutrition, and you are potentially watching them throw and saying that looks good or that doesn't look good. But in this setting, I don't have to do any of that. Like, I can worry about being a physical therapist, and then I work with our pitching coach to identify, is this person ready to begin throwing? What is the throwing program going to look like? And so on and so forth. So I think I'm just so fortunate to have all these other different disciplines. And I think I'm really lucky to work with a bunch of talented people as well. And so I think we all try to collaborate together as much as we can. And ultimately, the player just benefits most from it.
Are all the bases covered in that regards? I mean, yeah, yeah, sleep specialists, I don't know, finances even. I don't know. I'm trying to find, like, is there any area where somebody's covering it, but it would be really great if we had somebody that actually specialized in this realm to complete the mandala, so to speak, to make it all a complete team.
Yeah, sure. We don't have a sleep specialist per se employed in our organization, but we do refer out. We have a couple sleep specialty clinics here in Florida and a couple in Houston that we will refer our players out to if we know they're having an issue. Because obviously, as we all know, your S&C programming or my rehab programming might be the best program in the world, but if the player's getting 2.5 to 4 hours of sleep every night, that is not the low hanging fruit, and we are not going to get the adaptation we are wanting and we're looking for. So I think the goal is always to identify the low hanging fruit and then refer out as needed.
Cool. Okay. Professionally speaking, what's your biggest challenge?
That's a good question. I would say right now it is probably trying to provide the best quality care that I can, while also operating in a situation where we are in a reasonably high volume area. So we have a good amount of players that all need to be treated. And so it's providing the highest quality of care to everybody at the same time, I think can be challenging at times.
How many athletes will you see a day, and how many minutes or hours do you spend with each one? I know it will depend from one to the next.
Sure. Yeah, it kind of depends. It's difficult because unfortunately I can't tell you the exact number we have in our rehab group right now. But the great thing about the setting that I'm in is that if I see a post-op and I need to spend 2 hours a day with them, I can probably rearrange my schedule and I can probably do it. There are some guys who are long-term rehabs that I may only need to check in with them 5 or 10 minutes once or twice in a day. So it the fortunate part about the setting that I'm in is I'm able to kind of pop back and forth and see players for really as long as I feel that they need to be seen. And I guess that kind of leads into why it's a challenge, is because sometimes I feel like a lot of people need to be seen for a long time because I'm trying to provide the best quality of care to everybody. And there's only 24 hours in a day. So it's just trying to figure out how to be the best time manager and how to determine what I need to physically see versus what I don't need to see at all times.
Yeah, I mean, in the perfect world, you'd probably stay with the players all the way through their entire career, right? And just and dial it up when they need you, dial it down when they don't. But know that the body is a plastic entity that's always in a state of flux and change depending upon what it did from 1 minute to the next. So to to say that you are complete with rehab is actually not an accurate statement, at least in my imagination or my education. It's just like, okay, well, maybe you just don't need my attention quite so much, and we pass you on to the strength coach. But just know that I'm still thinking about that one thing with you, and I wish we had more time, so to speak. I'm sure that kind of goes through your head from time to time.
Yeah, for sure. For sure. Yeah.
Okay, so and in terms of PT, and what is out there kind of on the bright horizon. You've already mentioned force plates, that's been around for a while, and BFR as well, and breath work and all that. Is there a bright star out there that is kind of getting attention right now that uh, I'm not sure if there is or anything. I'm just kind of asking, like, as you pursue more knowledge and look at research journals, is there something piquing your interest?
Yeah, that's a good question. I would say, although it feels like it has been out there, I don't think that the traditional physical therapy setting uses objective measures to identify force expression, force absorption, power, speed, like whatever we are kind of KPI that we're discussing. I don't think there's enough clinics and enough people, unfortunately, doing it yet. So I think that is just going to continue to be, and especially obviously in my setting, that's a huge part of what I deal with. So of course that's going to be my bias, but I think that's going to be a huge part is continuing to educate clinicians on valid and reliable ways to measure force and use it to guide your programming accordingly. If that makes sense.
No, it makes complete sense. All right. So this season, well, you're always in season as a medical professional. So, but your peak time of year, would you say it's in the postseason, preseason, in season, or off season?
Spring training for sure. Yeah. So
Yeah.
probably first day of February until maybe mid-April in that 2.5 month span is definitely the busiest. We have all of our big league team and all 165 US based minor league players all in house. Every coach in the organization, every staff member all here at the complex at once. Games going on, there's media here. There's a ton of people. So that's definitely our busiest time for sure.
And right now, middle of July, what's it like for you in
Yeah, we're still
your
busy. I
daily
mean,
routine?
yeah, we're still pretty busy. The season basically runs from, I mean, call it February 1st when spring training kind of begins, or when pitchers and catchers start to report to the complexes. Spring training ends obviously end of March, beginning of April. That's when the big league season ends. Obviously, all the minor league seasons end or begin kind of right after that. The seasons are going to run. The lowest level A ball typically runs to the very beginning of September, and then the other minor league teams kind of trickle to the end of their season, end of September. And then the big league team goes sometimes into early October. If they make the playoffs, can be late October or early November. So I would say probably that like 7 to 9 month span is probably our busy season per se. And then November, December, January tend to be pretty light. All the players, for the most part, go home for the off season, and it's just the off season, so we tend to be a lot lighter during those times.
And what do you do during your off season? Are you just going back to school, or you got a family to attend to, or are you traveling the world?
Ideally, it's a little bit of everything. Anybody who works in pro ball knows that obviously during the season, it's a lot of work. I mean, we're working 7 days a week in spring training for the majority, and the way we do it, and I think most other organizations do it, is we work 6 days a week throughout the season as well. So when the off season comes, I think kind of first and foremost, you make sure every player has a place to go, make sure they're getting quality rehab, and they have every kind of duck in a line per se. And then it's kind of a combination. It's a little bit of con ed on my part, picking up some of the things that I feel like I need to get better on or I am just interested in. For me, last off season, I spent a lot of time trying to learn Spanish because it's not something that I know. I took German in high school. Looking back, that might not have been my best decision, but trying to learn Spanish. I'm trying to see friends and family that I didn't get a chance to see during the season. I'm trying to go home. This time last off season, I was picking out a wedding venue and going home for Christmas and some weddings. And so it's like a kind of a mix mosh of everything that needs to get done that just doesn't have the time to get done during the season. Just try to do it all in the off season.
Wow. And the wedding happened. She went through with it. I mean, you guys got married.
Yeah, believe it or not, she keeps me around. Don't know why. We're gonna get married next year, so we have a little bit of time, but we're gonna get married back. My fiance is from New York. I'm from Pennsylvania, so we're gonna get married up in the tri-state area. So we just went up when we had a little bit of time to look at wedding venues and not have to rush through the process.
Oh, good for you. All right. And you guys know what you're getting into with your work schedule by now. You're right on. So how do you prevent from like one professional to another? How do you prevent burnout? How do
Yeah.
you not get burned out?
Yeah, that's a great question. It's something that I think everybody in the field is still probably trying to figure out to a certain extent. I think that I think it's probably a couple things. I think you need to ask yourself, am I really burned out? Like I don't like what I'm doing, or I'm burned out that there is too much time spent in a certain area. And I think that kind of leads you into two ways, right? Because if you don't like what you are doing anymore, then you probably need to change a field or change a career. Versus if you are just spending too much time doing something, then you probably need to ask yourself, what, if anything, can I pull back on time wise? Like, am I doing a lot of extra learning on the side that I can pull back on a little bit? Can I maybe, instead of staying late for work every day, can I get in earlier in the morning and get out some of the busy work done? And then it allows me to get out a little bit later in the day, if that makes sense. So I think those two things are kind of helpful. Um, yeah, that's probably what I would say. I think it's different for everybody. I think everybody has a different word for burnout, and I think everyone's going to have a different strategy. I think other ways that you can get around it are by doing things that kind of fill your cup up in your time off. So whether that's doing nothing and laying on the couch, whether it's seeing family and friends, whether it's working out, like finding what stimulates you mentally away from work, understanding when it's time to push with work and when it's time to take a step back. And then also just it's kind of always a give and take.
Ah, no, that's good. Sounds like there's no such thing as balance, but orbiting around some hopeful center. Sounds like you're doing that pretty well. Now, if we were to talk to a young, up and coming sports physical therapist that is interested in pursuing your career path, what continuing education would you recommend the most?
Hmm. So probably what I would say is, and I kind of fell victim to this a little bit, is that I was really excited coming out of PT school and I said, I'm going to sign up for these 7 courses that I all really kind of want to take and do them all at once. And that's probably not the best way to do it. So I probably wouldn't say to do that. But I think there are tons and tons and tons of great resources. I will plug a few. The Calu community. Actually, they just switched up to Clinical Athlete. That is a great community of really good S&C providers and rehab providers. They do a tremendous job. Eric Miera, and any course he puts out is awesome. He's the science PT. Anything E3 Rehab will put out. I'm biased, but the residency program I went to, which is Rehab to Perform, they have a ton of awesome online courses. Trying to think of any others. I think that's kind of where my mind goes initially. Um, but there's always a ton of great clinicians out. I think some of the best things you can do is also follow people on social media that are doing the career that you want to be in and listen to what they say and read their blogs and listen to their podcasts and just try to absorb information, and that will ideally help to lead you in the right direction as well.
Great. Oh, Christian, now, uh, 5 years down the road, I'm going to sound like I'm hiring you or something, but 5 years down the road, where do you see yourself?
Yeah, to be honest, I tend to not be a 5 and 10 year plan kind of person. I think I've learned from myself that puts too much stress on me to like stick to one plan. And I'm not bouncing around somewhere every 6 months or anything, but I'm a firm believer if you work hard and you try to be a good human being and you try to make a good impression and you do the little things and you do everything right, that certain doors may or may not open. So I mean, I love the game of baseball. I'd like to be in this game for as long as I humanly can be, whether that's being a coordinator at some point, a big league PT at some point, front office position at some point. Like I just want to keep working hard. I want to keep being a sponge, learning the game, and doing what I can to help contribute to the Astros organization.
All right, that's beautiful. And now, if people want to follow you, like you say, follow people that you're interested in Instagram, do you have an Instagram handle, and what would that be?
Yeah, so I have a personal one. You probably don't want that because that's just pictures of the beach or whatever else I'm doing. I do have a professional one. It's christian.huckfeldt.dpt, where to be honest with you, I kind of go through phases in posting a good amount, and then sometimes I'll take a little time away if I'm kind of realizing it's taking too much time and effort. But I tend to just post not really for like clicks or anything. I just tend to post like what I'm thinking about and what I am contemplating and what my current thought processes on certain things are. So I always welcome criticism, constructive criticism, whether you agree, disagree, or anything in between. Like I'm always pretty much always willing to have a conversation. And even if you're just somebody who's a student or aspiring baseball PT or somebody, and you just want to talk and hash out what you think might be the best step, always kind of willing to hop on a call.
Okay, and then kind of final questions here because we're coming up against the clock, and I'm going to sound like I'm on the newlywed game or something like this. But can you name the the characteristics of your most ideal athlete to work with and the characteristics of the athlete that is just the opposite?
Yeah, the one who I want to work with, probably just put simply, is somebody who wants to get better, like somebody who can see where they are now, somebody who can identify maybe where they need to go. Either they know that because they've been told, or they're willing to listen, and somebody who's willing to put in the time and effort to get there. Like if they're willing to get better, I'll go above and beyond. I'll come in early, I'll stay late, I'll do anything that needs to be done to help that person kind of get there. I think the more challenging cases are the ones who maybe don't have that intrinsic motivation to get better, or have been through rehabs for a really long time and they've been out of the game for a while, and it's difficult to see the light at the end of the tunnel. That doesn't make them a bad human being or a bad player. It just means that they're just struggling with that part of the game. And I think those cases are fun too, because you get to try to encourage them and show them the light, whether it's small milestones or whether they're actually getting close to being able to play again. Show them the light at the end of the tunnel, and ideally get them kind of back on the field and healthy.
Well said. Oh, this has been great. I love diving deep into sports physical therapy, and you've achieved that. So I want to thank you. I learned quite a bit from you in the short amount of time, and well, I hope your boys continue to do well and maybe make it to the ALCS this year. And who knows, maybe that little 12-year-old kid can revive and relive a World Series ticket somewhere. But I just want to say thanks for coming on. I really appreciate it.
Yeah, thanks so much, Rocky. I appreciate you having me.
And that's a wrap for this episode of the Zealous Podcast. Thank you, Christian, for coming on, as well as the Astros organization for allowing this to happen. Remember, if you're looking for continuing education, just go to rockysnyder.com. We've got programs, clinics, workshops, and online courses, as well as in person, for athletic trainers, chiropractors, physical therapists, strength coaches, personal trainers, and a whole bunch more. Just go to rockysnyder.com. Maybe we're doing a workshop in your area. And for other educational products, you can go to setantacollege.com. They've got master's programs, science, and a whole bunch of fields for athletic, strength, conditioning, and performance. Just go to setantacollege.com, enter RS10 for 10% off your tuition today. Remember, we're on Instagram at Rocky_Snyder. Click that subscribe button, and we'll see you next week.